estimate are the extent to which an American can legally use cannabinoids. The research shows that endocannabinoid receptors could be used to do more than just fight symptoms. A search on PubMed.gov for the word cannabinoid yields 15,243 results. These studies, most of which involve non-smoked cannabinoids, show that endocannabinoid receptors could be utilized to have a uniquely profound impact on what is currently known as health. This is nowhere near a complete list, but here are 25 studies showing different diseases and conditions that could be treated or even healed by exploiting the endocannabinoid system. Breast cancer, artificial cannabinoids reduce the size and spreading of tumors. Prostate cancer, an artificial cannabinoid reduced tumor growth. Lung cancer, artificial cannabinoids stopped the growth and spreading of tumors. Pancreas cancer, an artificial cannabinoid inhibited tumor growth. Liver cancer, THC and an artificial cannabinoid impaired cancer cells. Cervical cancer, an artificial cannabinoid killed cancer cells. Colon cancer, an artificial cannabinoid reduced cell growth and killed cancer cells. Non-Hodgkin lymphoma, an artificial cannabinoid reduced tumor size. Leukemia, THC reduced tumor size and killed tumor cells. Skin cancer, artificial cannabinoids reduced the growth of tumors. Cirrhosis, an artificial cannabinoid reduced fibrosis. Hepatitis, THC inhibited hepatitis. Alzheimer's, an artificial cannabinoid protected neurons and reduced cognitive impairment. Parkinson's, THCV could slow progression of PD. Multiple sclerosis, an artificial cannabinoid reduced neurological disability and progression of disease. Arthritis, artificial cannabinoids protected cartilage from degradation. Cardiac arrhythmia, anandamide and an artificial cannabinoid prevented arrhythmias. Insomnia, an endocannabinoid increased sleep. Sleep apnea, cannabinoids suppressed sleep-related apnea. Inflammatory bowel disease, artificial cannabinoids reduced inflammation. Depression, endocannabinoids may treat depression and anxiety. Post-traumatic stress disorder, an artificial cannabinoid could help control nightmares. HIV, cannabinoids inhibited TAT. Osteoporosis, an artificial cannabinoid increased bone mass and protected against bone loss. Nicotine addiction, an artificial cannabinoid could help smokers quit smoking. The bulk of trials that do move on to humans are those that show potential to control symptoms. For some reason, almost no experiments that show potential to actually cure disease move on to humans. Interestingly enough, in all of history, there hasn't been one study done testing the curative effect of ingested cannabis cannabinoids on humans. The only study on humans testing the disease-fighting properties of non-smoked cannabis cannabinoids took place in Spain in 2006. They took the lone cannabis chemical THC and directly injected it into malignant brain tumors of patients. As suspected, it had a cancer-fighting reaction in some of the patients' tumors, and those patients lived much longer than expected. But since then, no more clinical trials of this nature have been performed on humans. Despite the mountains of research showing the disease-fighting potential of cannabinoids, both artificial cannabinoids available to sick Americans are modeled after the same cannabis chemical, and all they do is alleviate a few symptoms. In 2007, using a new method to target the endocannabinoid receptors, the French pharmaceutical company Sanofi Aventis came close to bringing America its next cannabinoid drug. They theorized that because CB1 receptors stimulate appetite, shutting those receptors down could help reduce appetite and help people lose weight. They didn't know exactly which CB1 receptors controlled appetite, so they made a drug that simply blocked as many CB1 receptors as possible. Their drug, called Acomplia, made it all the way to an FDA Phase 3 trial. Patients were indeed showing signs of reduced appetite. The drug also showed potential uses for nicotine addiction and metabolic disorders, but the FDA stopped the trial when some patients formed extreme anxiety and depression and attempted suicide. Patients with a history of depression weren't allowed in the study. Although Acomplia was not approved in the US, it was approved in Europe, and it was available in 56 countries by 2008. It quickly became clear, however, that its negative effects outweighed its positives, and it was pulled from the market by the end of the year.